close enough? Okay. Alright, so, okay, here we go. Hello, Dr. Green. My name is Susan Midday. This is my son, Kieran. He's agreed to be my model for the physical assessment. Kieran, do you give verbal permission to participate as a model in this assignment and be recorded for school purposes for Aspen University Class N495?
Yes.
This assessment is intended to show my skills with the assessment actions only and is not to be used as a direction for your health status or follow-up with any irregular findings. Do you understand this?
Yes.
Okay. All right. I have washed my hands. I've applied gloves, and we have probably both put on a mask because of COVID-19. But for purposes of this exercise, we're going to assume that's done. Kieran, while you're standing, I would like you to walk over there past the exam table. Walk that way. Okay, and now walk back this way. And I'm assessing his barefoot gait. And then while you're standing, would you walk heel to toe for me? Put heel to toe like that. Good. He appears to have no gait problems. Okay, okay. Come over here and sit on my exam table, please. Now, why don't you sit on the end right there? Yeah, right there. Okay. I'm taking your temperature. I just need to point there. 97.3. That's good. And I've recorded that. That was 10-4. Okay, and your pulse is 80. Your pulse is, well, okay. First I'm going to put this on. Okay. Truth is, it's 12:30 in the morning and I'm a little tired, Dr. Green, but we're going to soldier on. And I'm going to feel your pulse, okay? Okay, your heart rate is 84, your respirations are 15. I'm going to take your blood pressure, okay? I would normally take your blood pressure in the other arm, but just so the camera has a good sense of exactly what I'm doing, I'll take it here. Okay. I've assessed your brachial artery. Now I want you to put your arm out. Just relax it like that. Blood pressure's 126 over 84. That's good. Are you in any pain?
No.
Okay, good. All right. Now, if you don't mind, just move over here toward the edge of my exam table, Kieran. Okay. And then just sit down on the edge of the bed real quick, and the table. And yeah, just put your feet off the edges, and I want you to. I just want to look at your legs. Okay. Okay. So lift up your legs. Lift. Okay. Now pull your knee up to the ceiling. Good. And your other knee. Good. Okay. Push against my fingers with your feet. And the other foot. Now step on the gas. Okay. Good. Okay. All right. Put your head. And I'll also stand up. I want to do one test for you. Stand up, please. In testing your balance, I want you to close your eyes and lift up one leg. Put your and okay. All right. Good. Okay. Okay. It's all right. It's all right. Okay. All right. Okay. Go ahead and sit down. Okay. And now. I'm going to look at get my papers so I keep myself on track, okay? I forget if I said I've washed my hands.
Yes.
Okay. All right, I'm looking at head, face, and neck. Pardon me.
Vampire.
And appear to be intact without redness or deformity. I'm looking at or palpating carotid and temporal arteries right here. Okay, I feel it. And open and close your mouth. Okay. I don't hear any clicking. Do you ever have pain when you chew? No? Okay. Looking for the thyroid. I'm looking for each side of the trachea, and the trachea is midline. I don't feel the thyroid. Okay. Breathing. You're breathing well. You're not working at breathing. You're breathing about 15 times a minute, and I don't hear any sounds, just about a stethoscope. I'm going to listen to your back. Well, first I'm palpating. First palpate. I'm palpating, looking for swelling and redness. And oh, by the way, I appreciate you doing this for me, Kieran. I know that you really didn't want to take your shirt off for the camera, and I can respect that, okay? Okay, so everything seems to be intact. Listening for breath sounds. Yep, take a deep breath, good. 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 Yep. Good. Okay. All right. Posterior chest is intact. Now, what I want you to do is say 99.
99.
Good. I hear fremitus. That's good. That means that you're moving the air well, and your voice is good. And I'm also going to wrap on my hand a little bit, looking for consolidation in your lungs. So that's like pneumonia or fluid in the lungs. Okay, and that seems to be intact. Now I'm also going to listen to your chest in the front. Deep breath. Good. Okay. And while we're up here listening for bruits, I'm just listening for obstruction in your carotid arteries. And basically, if I hear anything, that means there's an obstruction, and I don't hear anything. So that means you're clean as a whistle. Okay, and I'm listening to the heart sounds. I'm looking for sounds at the aortic, pulmonic, tricuspid, and mitral valves. Listening with the flat part of my stethoscope. Everything sounds normal. Okay, and then I'm using the bell looking for abnormal sounds, and I don't hear any abnormal sounds. So S1 and S2 are heard, S3 and S4 are not. There were no murmurs. All right, just lie down, put your head over here on the pillow. Good. Now I'm inspecting the abdomen for contour, bulges, and pulsations. If abdomen's round, there are no bulges, and I don't feel any pulsations. Pulsation is like with like if you had a problem with your aortic, with your aorta, and I don't feel anything like that. I'm going to listen to your belly. Okay, just looking to hear bowel sounds to see how well food's moving around down there that you ate earlier today. Okay. I hear Rice Krispies. Did you have Rice Krispies? So I listen at each quadrant for a minute. I'm simulating a minute, and if I'm hearing sounds within a minute, that's considered to be normal active. If they're really, really active, that's hyperactive. If I don't hear bowel sounds, that is absent. And I'm doing that for each of the 4 quadrants. And your bowel sounds are very active. Okay. All right. And also, let's see, let me look back at something here. You know, I just realized I didn't look at use my pen light in your eyes. Could you sit on the edge of the bed here? I know you're tired. I'm sorry. Thank you. I appreciate it. You're a trooper. Okay. So, see what happened. I got off track. Okay, it's all right. It's all right. No problem. Because I'm moving on. Right? Right. Okay. Trigeminal, we did the jaw clench. Okay, I want you to raise your eyes, raise your eyebrows, keep your eyes closed tight, and then smile and frown. Okay. So that means that your cranial nerve 7 is intact, and I want you to clench your jaw. Okay, that's strong bilaterally, so cranial nerve 5, trigeminal is intact. I've heard you speak before, so I know your speech quality is excellent. Cranial nerve 12 is intact, the hypoglossal, and I'm looking at cervical lymphatics. So I'm looking here, feeling for swollen lymph nodes, there, here, up here, behind the ears, there, and I don't feel any swollen lymph nodes. Okay? Good. Your skin is has pink. It's slightly moist and warm to the touch. Skin turgor is good because I pinched the back of your hand and there was immediate rebound. Your cap refill time is within 3 seconds, and I pressed on both of your ankles for 5 seconds, and there was no pitting edema, no edema noted at all, in fact. Okay, now I'm also looking at your eyes. Look at me. Your eyes are intact. They're both looking straight at me. That's good. And so I'm looking at the 6 cardinal fields of gaze, so I want you to look. Keep looking, look straight at me, right? And now look up, yes. Down, right, left, up to the right, up to the left, and down to the corners. Good. Okay. The 6 cardinal fields of gaze are intact, and your peripheral vision, so look straight at me, and I want you to tell me when you can see the pen.
I can see it.
Okay.
I can see it. I can see it. I can see it.
Okay. All right. Peripheral vision's intact, and I'm simulating using a pen light. So I'm shining a light. The pupil constricts. And then I shine the light and observe the other pupil to test for accommodation, and accommodation is intact. Pupils are perla. I'm looking at the ears for color, drainage, and tenderness. They appear to be pink. There's no drainage. Are your ears tender? Do they hurt?
No.
No. Okay, and I'm looking with my eye and ear speculum. I don't see any wax. The eardrums are pale gray and non-distended. I'm also going to look at your mouth. So I'm simulating I have a tongue blade. And say ah. Uh-huh. And when you said ah, your uvula, I did notice that it did rise. So cranial nerve 9, glossopharyngeal, is intact. I'm looking at maxillary and frontal sinuses. So does that hurt?
No.
No? Does this hurt? No? Okay. Sinuses appear to be intact, and I'm also looking at your nose. Just look at the upper ceiling, and and I might use a nasal speculum to look in here, or I just might use a tongue blade just to look for polyps or a swelling. septum is midline in the nose. And the tympanic membrane, I'm looking at that, and it is pale gray and non-distended. I looked inside your mouth, and the color was pink. It was moist, and teeth were good. I saw no lesions. Okay, so now I did assess your whole back and chest. So I assessed your thorax before and your abdomen. Now go ahead and lie down, and we're almost done. No fair going to sleep. If I have to be awake, you have to be awake. So, so I'm looking at joints, wrists, elbows, shoulders. Looking for complete range of motion in all of your joints. Fingers. Assess pelvis. Knees. Ankles. And the toes. Okay. I'm palpating bilateral radial pulses. They're equal. And dorsalis pedis bilaterally, or equal bilaterally. And also posterior tibial, they're also equal bilaterally. Okay. All right. We assess your gait as you sat down. I want you to stand up. Sit up. Just sit up on on the table, and then close your eyes and touch your nose with your finger. Okay, put your here. Let's do this, and now touch your nose. There you go. Good. Okay. I would also test for reflexes. I would have my hammer and test over here, hammer hitting right about there, and also the knees. Hammer. Okay. There's the cerebellar test is rapid alternating movements. So that would be, put your hands on your knees, and I want you to flip your hands up and down. There, that's rapid alternating movements. And he can do that. He could do it a lot better if it wasn't 1 o'clock in the morning. And Dr. Green, that's a wrap. Appreciate your patience with me, and I hope you're doing well. Have a good night. Bye.